Assalamu alaikum, dear doctors. I am Dr. Azhar today with a new topic for MRCGP International. Today, my topic is hypothyroidism. In this case, mostly female patient will come. Her age will be around 28 up to 40, and she will present and say that, doctor, my periods are irregular. Or she can say, doctor, there is change in my voice. Or she can say, I have excessive hair fall. Then you will ask the specific points of history other than family history, psychosocial history, drug history. What are these points? First of all, ask, are you married? If married, do you have children? If yes, how many children do you have? If no, then ask, did you have any pregnancy before? Or did you have any abortion before? Are you using any contraceptive method or birth control method? Is there any bleeding in between your periods? Is there any bleeding after intercourse? What about your weight? How's your mood? How's your sleep? Are you snoring at night? Do you feel that there is excessive growth of hair on your face? What about your hair fall? What about your diet? Is there any change in your voice? Is there any swelling in front of your neck? Do you feel that you have double vision? Dear doctors, these are the specific points of history other than routine history. Now, in this case, you have to examine the patient also. What examination you will do? First, check the pulse, blood pressure, and weight. Then, examination of eyes. Then, examination of front of neck. And examine the edema on hands and feet. This is the examination. Now, how you will explain the diagnosis? First, you will ask, first you will say that the examination which I have did and the information which I have gathered from you, it looks to me that you have hypothyroidism. Do you know about this? If she will say no, then you will explain that there are certain chemicals in our body which are produced by thyroid gland, which is situated in front of our neck. These chemicals we say in medical terminology as TSH. When the function of the thyroid gland is disturbed, then this gland produces more TSH. This TSH is controlling many functions of the body. With its more production, many functions of the body also become disturbed. Do you understand me? If she will say yes, if no, then you have to explain more. Now, what tests you can write for this patient? Of course, thyroid function tests and thyroid antibodies and all other routine tests. Then you will say the patient that I will give you appointment after a week. I will see your lab results, and after the confirmation of the diagnosis, I will write a treatment for you, or maybe I will refer you. Then she can ask you that where you will refer me. Then you will tell her to the endocrinologist, or for face hair, excessive growth of hair, you can refer her to dermatologist. or for weight control, you can refer to dietitian. She can ask that what medicine you will write after a week. She want to check your knowledge also. Then you will say that thyroxine is a medicine which I will write for you. Then she can ask that how we can use this thyroxine. Then you can tell her that if you can explain that if the age is less than 65, then we can start it from the dose of 100 microgram daily, and after 4 to 6 weeks we will repeat your TSH until the TSH is controlled. We will change the dose, and then annually we will do TSH. If the age is more than 65 or there is heart disease, then we can start thyroxine with the dose of 25 microgram daily. And if there is pulse rate is high or heart is racing, then we can add propranolol with this. Dear doctors, I hope you understand the case and you like my lecture. Please take care of yourself. See you in the next lecture, and goodbye.